The question about AI being a bigger threat on the basis of the data that we see is twofold. Is it really becoming a threat because there is an increase in the number of outbreaks, or are the countries improving their surveillance and diagnostic measures and therefore they're picking the disease more and reporting it more? We have to balance these two issues. However, what we've seen recently from December data to January, we are seeing a spike in the increase of the number of outbreaks of highly pathogenic avian influenza in the global sense, from the global perspective. Yes. As the OIE, yes, we are seeing this, we are receiving this, and we are seeing this increase in the number of outbreaks that are being reported to the OIE, and therefore, as an obligation, we have to inform our members, the countries that are reporting to us, and alert them of this increase in the number of outbreaks that we are seeing, so that they can take appropriate measures and be prepared, and all this and take measures that are appropriate for what they are seeing on the ground. Yes. Avian influenza, we are more of an intergovernmental organization that is responsible for setting standards for disease surveillance, for avian influenza surveillance, for biosecurity. What we mean by biosecurity, what measures are we saying should be implemented by the country to prevent spread of the disease, introduction of the disease, spread of the disease, and eradicate the disease. So we make recommendations, and where there is need to be capacity to be built, we do what we can within our mandate, and at the same time we work with our partners, cooperating partners, other international organizations, to help countries to implement these control measures at national level or at regional level. And we also, as the OIE, as an example, we do combined missions with our partners, the food and agricultural organizations, to visit the country where they need assistance to do a scoping exercise on what is happening regarding disease outbreak, if it's an influenza or any other disease, and make recommendations to the countries to take appropriate measures. And at the same time as OIE, we may pass the information to our partners who have the capacity to to work with the countries to implement measures, surveillance measures or biosecurity measures at national levels. Yes, there is quite a number of measures that the industry can take to protect themselves. First of all, when countries receive alert messages on outbreaks of highly pathogenic avian influenza in wild birds, which of course, as the countries report, they should not affect trade in poultry because the disease is now being seen in wild birds, is for the country to take measures to prevent introduction of the highly pathogenic avian influenza in wild birds being introduced to the domestic poultry. And these biosecurity measures are variable, and it's up to the country to take the appropriate measures which are practical to them and will be most effective in preventing introduction of highly pathogenic influenza from wild birds into the domestic poultry. These biosecurity measures, the surveillance measures, we do have standards for to describe what it means by biosecurity measures, what can be implemented, and because the standards are there, it's up to the countries who are members of the OIE to take these standards and adopt them at national level and implement them at national level. Avian influenza, I think it's a disease that because of its linkages to the wild population, we basically have to take measures to prevent its introduction from the wild population into the domestic population. So we cannot, at the same time as the organization, we do not advocate for measures such as stamping out in wild birds because it's impractical, it cannot be achieved, it cannot achieve disease control and disease preventive measures. So the first thing is to report what you see in the wild animals to improve preparedness. Then what is practical for the countries to do is to implement preventive measures, biosecurity measures at national level on the domestic poultry. I therefore cannot say it's a disease that in the foreseeable future we can eradicate it.